Hi, welcome to this Care Instagram Live questions and answers. It's all about IVF with donor eggs and our new frozen egg bank, egg donation IVF with Care Fertility. So my name's Deborah Law and I'm the Care Director of Governance, and my job is to make sure that the teams really continually try and do everything they can to make your experience and the service we offer to you better. And I'm here with two of my amazing colleagues. We have Alison Campbell, who's our Director of Embryology.
Yeah.
And it's Alison's amazing team who have made sure we've got all the technology to freeze eggs and the expertise to be able to offer the service. And my colleague Selena Wilkinson. And Selena's team are the people who recruit our amazing donors, so we are able to provide you with this service. So you're joining us today from the Care Training Laboratory in Manchester. This is where we train all our staff, so we've got the fantastic expertise to freeze eggs. And you'll see that we are distanced. I'm not sure if the camera angle will show it, but I promise we're 6 feet apart. And that's why we've taken our masks off. But yeah, we're doing our best to make sure we stay in camera shot. So the first thing I'm going to do is talk to you about the benefits of our frozen egg programme. And then we're going to take some questions and answers from you, our viewers. So, why would you want to choose to have treatment with donor eggs from our frozen egg bank? I think one of the most exciting things about the new egg bank is the opportunity for you, the egg recipients, to choose your own donors. We're hoping this empowers you. You can go online and choose a donor whose eggs are available for your immediate treatment. That means there's less waiting time, we won't have to synchronise your cycle with the donor, and we know for sure that we've got the eggs ready in our bank waiting for your treatment. We know that if we have the chance to, we don't have to synchronise your treatment with that of your donor, that reduces the stress and anxiety. If we're having to, it doesn't happen often, but sometimes women are all unique and different, and they respond differently to the sort of stimulation we offer. And so if we are managing both a donor and collecting their eggs, if something goes wrong with that part of the treatment, it can be really, really stressful and make our egg recipients really anxious. So having eggs from our frozen egg bank, we know they're all there, ready for your treatment, and that hopefully reduces any stress and anxiety. We are really keen to make sure that everyone can access all of our treatment services. So we know that some of our funding packages through Access are available for egg donation, and our frozen eggs are also available if you're having treatment that's funded by the NHS. So why would you choose to have eggs from our bank? We've got excellent success rates, and just at the moment, I think we know that we're keen to launch now because we know that lots of patients have previously travelled abroad for treatment with donor eggs, and we know that people will be anxious or just unable to travel abroad at the moment. So we think it's a really excellent time to make our frozen eggs in our amazing new egg bank available for treatment, and that's why we're launching, and that's why we're all here with you today. So I'm going to hand over now, and I'm going to be the host, if you like, and I'm going to ask my lovely colleagues here to answer some of your questions. So we have had some questions sent in already, and so a really common question that we've been asked is what the process will be for choosing an egg donor, and will I be able to see all the donor's characteristics online? And I think, Selena, you can probably tell us a bit about that.
I certainly can. So yes, the process is really easy. First, you need to register with your chosen care clinic, and you can register through the website or through our GEM team, and they can book you in with a consultant at one of the care clinics. They will then refer you to our donation nurses, who will meet with you and take you through the matching process and tell you how we recruit our donors, and then they'll refer you to a counsellor, and you can have implications counselling. Once you see the donation nurses, they'll tell you about all the packages that we offer, so the frozen packages or the fresh packages, and once you've decided which package you like, and you want to go with frozen eggs, they'll just send your request through to the bank, and the central egg bank will send you a link to a portal. So that's your own personal portal where you can then click on view my donor eggs, and you can select a donor by filtering certain characteristics, so hair colour, eye colour, ethnic group, height, and then once you've searched on those things, you'll be able to display all the donors that are available to you. And then you select a donor, and the egg bank will ask you if you'd like a copy of the pen portrait, so that's the donor information form that they complete. That just tells you a bit more about them than just characteristics, and that's if you want that information. And then once you're happy with that, you can then be matched to that donor, and that donor can be shipped to your clinic, the donor eggs that is, and the local donation team will set up your cycle, and you can go off your own period. You don't have to wait to be synchronised to a donor, so it's much faster for you.
That's brilliant.
Yes,
that's a really, really comprehensive
It's a really long answer.
Yeah. No, it's a great answer, because I know lots of people are really keen to know what the pathway looks like. So have we had any, do you know if we had any new questions in?
I think there was a question about the quality of eggs. So if we could talk about that a little while. Well, if we start with recruitment of the donors, and then I could talk a little bit about the
Yes. So we do have very strict criteria for recruiting donors. So firstly, donors expressing interest. I mean, we get a lot of inquiries about lots of wonderful people wanting to donate, and we have to, make sure it's safe for them to donate, and also look if there's any inherited conditions that might be passed on, or any risks to them having the actual stimulation treatment. So we look at their medical history, we assess their genetic history, and then if everything's okay, then they come to see us, and we assess their fertility as well, so to make sure that they're suitable for donation. And if all the test results come back, we then screen them. So we do quite a lot of screening, and we're governed by the Human Fertilisation Organisation, so we're very strict regulations on what we screen for. So all the infectious screening, we also check for the carrier types, that looks at their chromosomes, and the most common mutations of cystic fibrosis, and we also look at certain ethnic groups, whether other screening is required. And so it's quite a lengthy process they go through. We also do write to their general practitioner to ask if they've got any concerns, because we want to make sure it's safe for our donors coming through this treatment. And then once everything's okay, then they start the process, and they're very committed donors, and they're often doing this alongside their busy life, and they're doing it altruistically. They don't get paid loads of money. They're purely getting expensive. The expenses they get is strictly regulated by our governing body. So they are very committed to the process. So I can't thank them enough, to be honest with you.
I think they really are amazing individuals who go through the process of donating their eggs, so that they can help other people grow their families, and I think we are very grateful to them.
We are, and when you read some of the donor information that you will get, you'll see how much effort they put into writing that. And a lot of donors do say to me, "Oh, is that a test? Are they going to be testing me on what I've written about myself?" So it just shows you how much it means to them, their donation, and they often bring back to say, "Has everything gone okay with my donation?" and want to know the outcome of their donation. So I would like to thank donors, definitely. So that moves on to that's the quality of how we assess.
So the quality of selecting the donors. So many donors would be rejected, I imagine, for all sorts of reasons. So we recruit the donors that we think are going to give us the best donor eggs, really, for our bank, and then they'll go through the stimulation protocol so that their ovaries produce a good number of eggs, and then we'll do the egg collection just like we would with an IVF cycle. And in the laboratory where me and my team would be, we look down the microscope very closely at the eggs and prepare them for the freezing process, and that's really when we can also get another impression of the quality of the eggs. So we will only freeze the mature eggs, so that they're the ones that we can add sperm to at a later date, and really we can get an impression of the quality, but it's only when we add the sperm and create the embryos that we can really get the best idea of the quality. But up to that point, we've done everything we can to make sure that we are recruiting the very best quality donors and freezing only the best quality eggs.
So we've had a question from Charlotte, and she wanted to know how we are going to manage the system fairly, so that we can make sure that all our patients get access to the eggs that are in our bank.
Okay, so we are very lucky because we've got a lot of eggs in our bank, so not to worry that there won't be enough eggs. Already we've had a lot of people accessing the bank, and we've only been launched a week, and we're very quick at dealing with everybody's inquiries. So for people that are already on the waiting list, have also accessed the bank straight away. For new people who've just completed their consultation, so there's enough eggs in the bank, so there's nothing to worry about there. It's going to be, and also there's donors presently coming through to treatment, and we're going to add to the bank continuously.
I think it's really important that people don't worry and rush their treatment,
Yes.
because you mentioned the pathway earlier, you want to see a consultant, and we want you to think about the implications. We talked about having implications counselling, so we wouldn't want anyone to rush their treatment because they were worried about whether the eggs would all be gone. We've got lots of eggs in the bank, and we are continually replenishing those eggs by recruiting new donors. So we want you to be confident. We're launching now because we think this is the right time, and we can give everyone who needs it access to our frozen eggs. So we talked, I think one of the questions was, maybe this one for you, Alison, is how is using frozen eggs different from using fresh donor eggs in treatment?
Right, well, so we've talked about the benefits of frozen over fresh, and that's really for the patients in terms of flexibility, I think, and choice. But the difference as well in terms of success rates, I'd say there is no difference. If we looked at our data from the whole of last year, for example, we saw similar, very, very similar clinical pregnancy rates, ongoing pregnancy rates with our fresh and with our frozen eggs. So if I remember exactly, we had 47% clinical pregnancy rate with our fresh eggs and 48% with our frozen eggs. So it just shows that the freeze-thaw process isn't compromising the eggs in any way. So I think there's so many benefits really, and that's why we're really excited about this prospect.
A lot of people are finding the platform really nice, that they're in control, whereas before the donation nurses were selecting their donors, ringing them up with information. Now they're in control and selecting their own donor, and they're really feeling back that they really prefer that they can do it in the comfort of their own home and have more time to discuss it. So.
And they've sort of got more power to choose the person that they'd like, rather than our teams thinking they found the perfect match. Yeah. So what about the pathway? So I know that if we're in a fresh cycle, sometimes the person who's having treatment has to have their cycle synchronised with the donor, and then can maybe take drugs for quite a long time before the cycle.
That's right. So with a fresh cycle, the donor's cycle has to be matched to the recipient cycle. So sometimes that can take 2 or 3 weeks of preparation of injections on the recip's cycle, and then the donor starts her treatment, and then if anything goes wrong along that journey, it can delay or be uncertain really, say if the donor didn't respond or if the donor had to pull out for personal reasons. So there's all that uncertainty around the fresh, whereas with the frozen it's much, the eggs are there and there's no other person now, body that has to be monitored. It's just about the recip and thawing those eggs and creating those embryos back for the recipient. So it's a lot less stressful.
So Alison, I know that we use ICSI for fertilising and frozen eggs. Can you talk us through the science of that?
Yes. So with fresh eggs, or with any eggs, when we collect them, they are surrounded by a cloud of nursing cells. So if the recipient couple were destined to have IVF treatment, so the sperm quality seemed to be sufficient in number and motility, the movement, and the morphology, which is the shape of the sperm head, for us to add them and let them fertilise in an IVF environment. We don't need to remove these nursing cells. The sperm quite like them and they swim through them, they get activated by them, and that's how the fertilisation takes place. Our alternative method of insemination with fresh eggs is ICSI, and this is generally used when the sperm numbers or quality are lower, and in preparation for ICSI, we remove all of these nursing cells. Then we can get a really good look at the egg, eggs maturity, and using micromanipulation. So this piece of equipment behind these lovely ladies, it's a micromanipulator, and this is where we would perform ICSI. So we just inject a single sperm into the middle of each mature egg. And it's highly successful. More than 50% of our patients undergoing fertility treatment will have ICSI. It's very well established. And with frozen eggs, that is the technique that we use. And that's because we've removed the nursing cells in preparation for the vitrification, the freezing method that we use. So when we thaw them out, they're ready, they're mature, and the nursing cells aren't there. So we use ICSI and inject the sperm right into the centre of the egg, with great success. So at least 70% of eggs that we undergo ICSI will fertilise on average. So it's very well established and successful technique.
So I'm sorry about that pause, but we're back again, and we can answer some more of your questions. We had some technical problems, but we're back. So one of the questions we've had is, what happens if the eggs don't thaw? If they don't survive the thaw, I guess.
Is this for me?
Well,
yes,
either of
for us.
Right, well, first of all, I would say that this is it's very unusual, but it does happen occasionally. And if that, well, some eggs don't survive. So 85% of all eggs, on average, will survive the freeze-thaw process. So most recipients will certainly get some eggs for insemination for ICSI. Then we've said that 70% on average will fertilise, and then about 60% of those will go on to develop into transferable blastocysts, a stage of embryo development. So we've modelled all of this very, very carefully so that every recipient has a very good and realistic chance of having a transfer, and with that comes around a 50% chance of success. So there will be very rare occasions where none of the eggs survive, and of course in that case we would send the couple, the patient, back to the donation team to talk about their options and a rematch, and we'll try and salvage the situation as best we can on a case-by-case basis, but it is a very rare event.
So I think they'd be matched again.
Yes, so we
Much
do it on an
easier,
individual basis, and we know if you want to go with another package, you'd be put through back to do your online matching again to a new donor.
Yeah. So someone's also asked, how long will it take to start to have treatments once someone's chosen their donor eggs?
Okay, so once you've chosen your donor eggs, it depends where your donor eggs are within the care group, but they will be transported to your clinic where you're having your treatment. Your local donation team will organise the protocol, the treatment plan, and you'll be able to order your drugs. So it's just the time that which period you want to start. Obviously, not everybody does go off periods, and some you can just start as soon as the eggs have arrived at your clinic. So it should be within the month really of getting your eggs.
So I think there's no real delays from our side.
No.
As long as the patient's got their protocol,
Exactly.
they can start really whenever they're ready.
Yeah.
Depending on their own treatment cycle and the protocol they've been given.
Yeah.
So no delays really.
Yeah.
Excellent. So someone asked, can I have 2 embryos transferred instead of 1 after making them? I can't quite see the question.
I mean,
If so this is in a patient who's under 35.
Oh.
so this is with donors. So the success rate for donors eggs is around the 50% mark. So it wouldn't be recommended because there'd be a good chance that you'd be pregnant with twins, and obviously we're governed about how our multiple birth rate.
Yeah, and there are so many risks involved in multiple pregnancy, both for the mother and for the babies. So in almost all cases of women under 35, we would transfer a single embryo. But we give lots of information about the quality of the embryo. We talk about the chances of success. And we understand that every patient's completely different, and they've got different medical histories and different questions. So we would have a detailed discussion about that with every single recipient. But it would be very unusual for us to transfer more than a single embryo.
Yeah. I mean, we have proper discussions, really in-depth discussions. I mean, I'm not a clinician, I'm not a doctor, but certainly we'd really want to take all that into account.
Yeah.
We wouldn't recommend double embryo transfer if we have good quality embryos, would we? Because it's just, I think, too risky, really. So thank you for that question. We've also been asked, are we offering face-to-face consultations now? We've obviously been through a really difficult few months, and we are doing lots of consultations virtually. But again, wherever we can in our clinics, if a patient really wants a face-to-face consultation, I think we have the capacity to do that.
Yeah. We have Skype as well. We use Skype.
Yeah, lots of our patients have been really positive about. We've had some really good feedback about.
And there's a bit more flexibility as well, you know, around them when you can use Skype and not have to travel into the clinic.
But we can do face-to-face consultations in most of our clinics. We are taking every step we can though to make sure that our staff are protected. We do have to look after our staff, and if we've got any staff who might be particularly vulnerable, then we are giving them the option to work from home, just to follow government guidelines. But if it's something important, then best to contact your individual chosen care clinic, the clinic which is closest to you, where you might have treatment, to make sure. But I think in most of our clinics it's definitely possible at the moment. Yeah.
Yeah.
So we've been asked, is it very expensive? We know that there are different. You can choose different packages, can't you?
Yeah. So we have kind of 3 packages really. We have the fresh donation package, so there still is the option to go for a fresh donation, and there's basically purchased 2 sets of eggs, so a minimum of 6 eggs or a minimum of 9 eggs. In terms of the prices, I think we're best probably sending the prices. I haven't got them to hand now, but with using frozen eggs, ICSI is also included in the price, isn't it? So that's a bonus.
Yeah.
And Access Fertility as well. So with Access Fertility, I think that was on the question there, you get 2 standard sets of eggs, so with their package. And with NHS patients, it's a standard set of frozen eggs as well. And it's so much better for NHS to have standard frozen eggs because it's quicker. Often, sometimes NHS, they have to get the treatment done quickly within a certain period. So again, the efficiency of it is much better for them, as the success rate is just as good as fresh.
So there's information on our website, isn't there, about costs? But if I know what the cost of a set of eggs is, what is included, or is that just the cost of the eggs? Because someone asked us what's included in the price. Does it include embryo transfer and everything?
It doesn't. So it just includes the price of the eggs and ICSI with the frozen packages. So obviously that price includes all the creation of those eggs, the donor's treatment, the donor's expenses, the donor's drugs, etc. And it includes the monitoring of yourself and the first embryo transfer of the fresh embryo. There's any additional costs would be for freezing and storage, or any further frozen embryo transfers from those embryos, the surplus embryos that you might get with that first treatment. Is that clear?
Yeah. And a standard set, we said, is 6, at least 6 eggs.
Yes.
And a large set is
9. Yes.
So we've had a question about from a patient who was originally using fresh eggs to create embryos, but having to use ICSI because of the quality of the sperm. And the question is, when using fresh eggs, we have to use ICSI. Is it because they're harder to fertilise? Meaning, I think the question is about if the sperm quality isn't already as we would want for IVF, and we're having to use ICSI, does that make it even harder if you had to have an ICSI sample to start with?
So is it harder?
No, I think is the answer. So if you need ICSI, if I needed ICSI to start with, and I'm now using frozen eggs, does that make it even harder to fertilise the eggs?
No. It makes no difference. No difference.
So it's no more difficult if the quality of the sperm would have required ICSI in the first place. It's not doubly hard.
No,
it's
not
absolutely no difference.
Yeah, no.
So another question is about when creating embryos from frozen eggs, is it still possible to freeze the embryos for a frozen embryo transfer? And is all that freezing and thawing possibly detrimental? Does it harm the eggs or the embryos, in fact?
It's a good question. It's absolutely fine to freeze and thaw eggs, create embryos, freeze the embryos, thaw them. Absolutely fine. We've got a lot of evidence to demonstrate this. Embryo freezing is phenomenally successful. They're very resilient. The stage that we freeze embryos is the blastocyst stage. They have around 100 cells, and they are extremely resilient, and we have 99% post-thaw survival with blastocysts. And we have examples of when we've thawed blastocysts, taken a biopsy, re-frozen them, then thawed them for transfer with success with pregnancies, live births. So we're very, very experienced at freezing and thawing of eggs and embryos, and there appears to be absolutely no detrimental effect of doing both in one set.
Thank you. So another question is, are my chances smaller if I'm older, even if I use donated eggs? So how does age impact on success rates when you're using donated eggs?
I mean, because you're using donated eggs, the success rate is the success of the young donor, so it's just as good. Obviously, we'd have to assess your individual medical history to see if there's any risks to you personally, so that would be best answered by a consultant, I think, really.
So I think, like we said earlier, we're all unique, everyone's different, so it's a bit hard to answer that question, just blanket, but generally we accept, don't we, that success rates are more similar to, that they're a reflection of the age of the person who provided the egg, because I know certainly that as you get older your eggs quality declines, but in when we're using donor eggs, all of our egg donors are aged under 35, so your success rate should be influenced by the part of your success that's influenced by the age of the donor.
Most of it is the most influential factor. So we had a 30-year-old donor, which is about average, and the recipient was 40 or 48, we would expect the same success in the 40 or 48-year-old woman.
So this is a really good question too, one for you, Alison, maybe. Are we able to do PGS testing on eggs from the egg bank? So PGS, will sometimes we call it now PGTA, will be on our website. Can we do PGTS?
Yes, we could do. Yeah, if we talk about the pros and cons, generally for women under 35, which our donors are, we wouldn't routinely suggest PGTA. So this is a test of the number of chromosomes in the embryos. So we were just talking about maternal age, and with increasing maternal age, we see an increase in the number of errors in chromosome copy number. So if we use Down syndrome as an example, and many other aneuploid syndromes like that, with increasing maternal age comes an increase in those syndromes. So what we're looking for with PGTA is whether or not the embryos that have developed from the eggs, whether they be donor or not, whether those embryos have the right copy number of chromosomes, because if they don't, then the chance of implantation is very, very low, the chance of miscarriage is high, and there's a small chance of having a child affected with an aneuploid condition. So again, case by case basis, but generally speaking, when the eggs are from a young donor, there isn't an increased risk of these aneuploidies, so there isn't really an indication for aneuploidy screening, so PGTA.
Okay. So this is a good question. Have all the donors in the egg bank donated with care before?
Okay, so there's a mixture really. We have donors that have donated with care before, and we have new donors, so it's just a general mixture really. We have donors that love donating.
Well, that's amazing, though, isn't it? That's true. So, but also there are restrictions. So our donors can choose how many families.
Well, we
created
can
from the
create
donation?
10 families by law, but
Yes,
we
the
sort of
maximum by law is 10.
Yes.
Yeah.
But we sort of have a cut of how many times they come through, and that's just purely to reduce the risk to them. So normally we don't let them donate more than 6 times. I'd say on average the most is about 2 or 3 really for an egg donor. It is quite an invasive procedure and a commitment that they go through. But you know, some would like to go on and on and on.
I think that's amazing.
It is amazing.
Yeah. So will the child find out they were born from donor eggs? I don't mind answering that. So
yes.
I know from the regulatory perspective, they can. So any child can approach our regulator, the HBA, and ask if they were born from treatment with donated eggs or sperm, or even if they were born as a result of IVF treatment. and they can also, when they're aged 18, find out the identity of the person who donated the eggs. And we can't force the people who have treatment with donor eggs or sperm, and we wouldn't ever force anyone to do anything, but we would really encourage anyone having treatment with donor eggs or donor sperm to be open and honest with their children. But ultimately, the decision is yours.
Okay, so what is the waiting time? Okay, so with the frozen egg bank, there is no waiting time. As soon as you're ready, as soon as you've had your appointments and decided what you want, you'll basically have access to choose a donor online. If you're wanting a fresh donation package, there might be a little bit of a wait, so that depends on, the synchronisation, so you'll be matched by your local donation team for that. But for frozen eggs, no match, no wait.
So I'm just going to check, but I think I really do have to wind up the session now. A bit later than originally. So again, thank you so much for joining us.